watching Let's Chat.
Well, welcome back to Let's Chat. The American Cancer Society estimates about over 2,000 men suffer from breast cancer every year. And this morning we have Brittany Hennessy with the MaryEllen Locher Center. She is here this morning to talk a little bit more about this. How are you doing this morning, Brittany?
I'm doing well, thank you. Thank you for having me.
No, thank you for coming. Thank you for joining us this morning on Let's Chat. So tell me a little bit about, you guys have a special campaign, right? Tell me a little bit about that.
Yes, ma'am. It's called Peck Check, and it's to target the men in the Chattanooga surrounding areas that have been diagnosed with breast cancer, or in the future will be diagnosed with breast cancer. And it's just to target men to be more comfortable about coming in for a Peck Check. To if they have a problem, if they feel a lump, go to their doctor. That kind of situation.
Okay. Talk a little bit about some of the symptoms that men should be checking for or looking out for that may trigger them to go to the doctor's office.
Just like in females, males should do a monthly a breast check to feel for changes. And that's when once you feel a change, go to your physician and just let them know. And some other symptoms would be a lump, of course, just like with a lady, nipple discharge, kind of the same as with a female.
Right. Now, are there any different risk factors between a male and a female with breast cancer?
Sort of. For males, the number one is family history, genetic, situation, things like that. So that's something that if somebody in your family, close family, has been diagnosed with breast cancer, it's something that the male needs to inquire about for sure.
Right. And if they are diagnosed with that, what are some of the treatments that they will go through? Is it just like, with regular female breast cancer, possible chemotherapy and things of that nature?
Yes, if they're diagnosed with breast cancer, just like with the female, a lot of times they do have a mastectomy and go through radiation, chemo. They'll come back yearly for mammograms, and especially of the other breast.
Okay. And you guys have a nice campaign going on with some shirts that you're offering. Tell me about those T-shirts.
Yes. Well, it's more like a gown. When males come in here, and this is, from doing mammograms for so long, they're kind of intimidated because everything is pink. Everything's centered around the pink ribbon, including our gowns. And so we've had some ladies making gowns for us that are more masculine, have fishing, hunting, camouflage, that kind of nature. So a gentleman feels more comfortable being in here. There's not so much pink around. We're also renovating our oasis, and we're going to have a man cave where gentlemen can wait for their imaging and not be in a waiting room full of women.
Right. And speaking of being comfortable, is there a stigma, that men have with coming to get checked and worried about this? Do they feel like it's more of a women's issue and things of that nature?
There is. Being a mammographer as well, most of the time if you ask somebody's family history, if there's a male involved, it's like my grandfather had breast cancer, but he died of it. A majority of time that's the issue. And so men feel uncomfortable coming about a breast lump, and so it metastasizes, and sometimes it's irreversible.
Right. And what are some of those prevention measures that people should be looking out for, especially if you just have a man in your household or something like that, a suggestion or anything that you can kind of give them a little push to go ahead and get out there?
Yeah. Do a monthly self-breast exam. That is the number one thing they can do. Also ask, about their family history. Did your mother have breast cancer? Did your grandmother, your father, anything like that? Those two are very important signs and things to look for.
Right, exactly, because this is all very, very important to make sure that you're getting out there and taking care of yourselves, especially during times like these. About how often and how many people do you see have, male breast cancer?
Since 2018, we've had 12 men with breast cancer. We do have several men a week come in with a lump or something like that. And most of the time they are benign findings, but since 2012 or 2018, we've had 12 men.
All righty. Thank you so much, Brittany. This has all been great information, especially on something that we may not know much about, but make sure that you are taking care of yourself and your family members, and make sure you go ahead and check out the MaryEllen Locher Breast Center. Thank you so much this morning.